In the circulatory system, there are some special circulations we need to discuss. These are special anastomoses or portal systems. The circle of Willis is an arterial anastomoses. This anastomoses circles the base of the brain around the pituitary gland and the optic chiasma. It is formed by the internal carotid arteries, the anterior communicating artery, and the posterior communicating artery. It ensures that there's always an adequate blood supply to the brain, even if one of the arteries feeding the brain is blocked or partially blocked. Now, this is the base of the brain, and the circle of Willis goes right here. You can see that it's fed by 4 major arteries, and that a number of arteries that go to the brain come off of the circle of Willis, so that the brain is always adequately perfused. We've talked before about the pulmonary circulation, but what you may not realize is that the pulmonary circulation does not serve the metabolic needs of the tissues. All the pulmonary circulation does is bring the blood close to the air sacs of the lungs, the alveoli of the lungs, so that gas exchange can occur. The lung tissue itself is actually fed by arteries that come off of the aorta, that is, by the systemic circulation. So as we look at the pulmonary circulation, the only purpose for the pulmonary circulation is to bring these capillaries close to the air sacs of the lungs, literally for the gas exchange to occur. That's always what we've said has happened, but sometimes you don't think about the fact that these tissues are not nourished by that circulation. They get their nourishment from the systemic circulation. The hepatic portal circulation is a special circulation that brings the bloods from the digestive organs and delivers it to the liver for processing. The arteries that feed the digestive organs feed that tissue, but those capillary beds, besides feeding the tissue, also absorb all the nutrients from the intestine. This means that the blood leaving the intestine is extremely nutrient rich. It would have very high levels of glucose and amino acids right after eating, and very low levels if you haven't eaten for a while. To maintain homeostatic balance, your liver processes this blood, storing some of the extra glucose and extra amino acids when there are plenty in the blood, and releasing them later so that your blood has a pretty constant level of glucose and amino acids. The blood from the capillary beds are collected in the veins of the hepatic portal system, and this goes to the liver rather than straight back to the systemic circulation. After the liver has processed it, the blood pools back into the hepatic veins, and that returns to the systemic circulation. In the liver, we have some of those sinusoidal capillaries, so that the arterial blood that goes to the liver that nourishes the liver and the blood from the hepatic portal system mix in these sinusoidal capillaries, and then that all returns to the hepatic vein. So as we look at the hepatic portal system, coming off the stomach is the gastric vein. Then we have the splenic vein coming out of the spleen. The inferior mesenteric vein is going to drain from the lower end of the small intestines and the large intestine, and the superior mesenteric vein from the upper end of the small intestine. All of these merge to the hepatic portal vein, and the hepatic portal vein goes into the liver. In the liver, this blood mixes in the sinusoidal capillaries along with the arterial blood that nourishes the liver, and those sinusoidal capillaries drain back into multiple hepatic veins that drain back into the inferior vena cava. In the fetal circulation, we do not really have functional lungs or digestive organs. The fetus is getting nutrients and gas exchange through the placenta. It's getting that from the mother. There is one umbilical vein and 2 umbilical arteries that travel between the placenta and the fetus. The umbilical vein is carrying nutrient and oxygen-rich blood to the fetus. Veins carry blood to the heart, and this is what the umbilical vein is doing. This blood is going to end up in the fetal heart. The umbilical arteries carry waste away from the fetus to the placenta. Arteries take blood away from the heart, so this is moving away from the fetal heart. Most blood from the umbilical veins travels directly to the right atrium in a special blood vessel in the fetus called the ductus venosus. The blood that enters the right atrium is shunted across to the left atrium through the foramen ovale, and most of the blood takes that route. We don't really need that pulmonary circuit working other than to send a little bit of blood through it to make sure the blood vessels are developing. We want most of the blood to go straight to the systemic circulation. The other little detour we have for that oxygen nutrient-rich blood is blood that does enter the pulmonary trunk is shunted to the aorta through the ductus arteriosus. Here you see the fetal and the newborn circulation. So the umbilical vein is taking blood and it goes directly to the right atrium. We have a lot of the blood shunted over to the left atrium right away, or we have blood shunted into the aorta. Then we have the umbilical arteries that come off the iliac arteries that are going to carry waste-laden blood back to the placenta for exchange with the mother. At birth, these interior veins and arteries are going to shut down and become ligaments. The hole is going to close and the ductus arteriosus is going to close. So that when birth occurs, the foramen ovale closes off and you have that scar tissue in the wall of the atria called the fossa ovalis. The ductus arteriosus closes off and becomes that fibrous ligamentum arteriosum. You've seen both of these structures on the heart models. The ductus venosus clamps down and becomes fibrous. It becomes something known as the ligamentum venosum. And the umbilical arteries and veins also close down and they become ligaments as well. They become the medial umbilical ligaments and the ligamentum teres of the liver.